This is CBC Vancouver News.
Hi there, good afternoon. I'm Mike Killeen in the CBC Vancouver newsroom. Thanks for joining us online for today's COVID-19 special. We're doing this every weekday at 5 in the afternoon, and coming up in just a few minutes, we're going to be chatting with Dr. Shimi Kang, who's going to answer your questions about children and COVID-19. She's been with us before, so please fire away with any questions you may have related to that. Very timely, of course, with school supposed to be going back in session after spring break in British Columbia today, but that obviously did not happen. Okay, right now though, let's go over the top 3 things you need to know about the COVID-19 pandemic here in our province. First, 2 more people have died in BC, one of them representing what's being called BC's first community death. We'll explain more about that in a second. 86 new cases have also been confirmed in the last 2 days. You may recall the Health Minister and Public Health Officer, Provincial Health Officer, did not hold a briefing yesterday to update the numbers, so these go back to Saturday. Health Minister Adrian Dix says the Vancouver Convention Centre is set to free up hospital beds for future COVID-19 patients. It would function as a temporary healthcare facility, accepting patients recovering from other conditions. Dix also announcing an end to pay parking at hospitals for staff, patients, and visitors. All right, 2 more deaths, as we said, 86 new cases in BC in the last couple of days. Yet, 48% of patients who've tested positive have fully recovered. Still, BC's top doctor is warning our province has not yet reached the peak, and the coming week represents a watershed moment for this pandemic. So for the latest on what officials are doing to try to flatten that curve, let's bring in our Tanya Fletcher. She's live with us in studio this afternoon. So Tanya, we talked about this today marking the first community death. Talk to us about what that actually means.
Yeah, well, there was a lot of questions. Does that mean community transmission? Does that mean within the community? What does that mean? And Dr. Bonnie Henry clarified the first community death means the first patient to die of the coronavirus in their home, not in a hospital. So the BC Coroner's Service says it was a man in the Vancouver Coastal Health region. That's all they would confirm. But CBC News has since learned that the victim was indeed that dentist. Remember we told you about him last week. He was in his 60s, and it's believed he contracted the virus at that Pacific Dental Conference at the Vancouver Convention Centre earlier this month. Keep in mind, nearly 15,000 others also attended that event, and all of them were urged to self-isolate after several positive cases were traced back to that single event.
And if I've got my numbers correct, I think we're now up to 970 total cases in the province, so closing in on 1,000, but as we heard, 48% of the patients have fully recovered. And we also heard today of patients, Tanya, possibly being moved out of hospitals. Do we know who that might be and when?
Yeah, that's what a lot of people are wondering. And just pausing before we get to that, remember on Friday where we talked about BC was kind of doing the reverse of what other countries who were suddenly hit with this kind of without warning, like Italy, for example. Italy's hospital healthcare system was already at capacity. And so when COVID hit, they started opening up secondary sites like sports facilities and convention centers to put all the COVID patients. BC's trying to do the reverse. So they're trying to take out patients who are in the hospital right now, not in intensive or critical care, but if they can't, move them out of the hospital to maybe smaller hospitals, other patients in long-term care homes, maybe move them to alternate places of care so that it frees up those beds in the hospitals where the most critical care is, where all the ventilators are already located. And so that's where the COVID patients will go when we need to do that. So patients are already moving, the province says today. Again, it's not those in critical care, it's those waiting for placement in alternate levels of care, for example, those long-term care homes. And so that's being fast-tracked out of the hospitals to free up room in the hospitals for a potential surge of COVID patients. And every health region in BC, we heard today, is preparing off-site treatment centers Likely the first one that would be used if needed would be the Vancouver Convention Centre for obvious reasons. Its sheer size, its central location as well. On Friday, remember the province detailed 17 primary sites. They called them BC's biggest hospitals. Well, today they updated and said that number is now 19 primary sites. And that's in addition to, if we have to overflow, 38 secondary sites. Those are places like smaller hospitals or other facilities. And Health Minister Adrian Dix says no one will be moved to facilities like the Convention Centre this week, but it will soon be ready to accept non-COVID patients if there's suddenly a surge in coronavirus cases at the hospitals.
We're not moving anyone there soon, but this shows our determination to be prepared for people, and also to ensure that people who may have less serious illness or recovering from treatment other than COVID-19 can continue to be separated.
Now, there's also been some criticism from some frontline workers that BC is not testing enough people. They say that's what's required to really get a handle on the situation. But Dr. Bonnie Henry pushed back against that today, and she defended the province's testing strategies. She points out they're still doing upwards of 3,000 tests per day, so they're not doing any less. But what they are doing is focusing who they test. They're targeting potential outbreak clusters like care homes, like hospitals, and high-risk people like healthcare workers. She says for the most part, that strategy is working.
It's not that we're decreasing the number of tests we're doing, it's that we're focusing the testing on the people who are most likely to need the healthcare services. And we are still maintaining the contact tracing. We're talking with people who have this, who have mild enough illness that they're able to stay at home. And for the most part, that is working.
Okay, and Tanya, there's been quite a bit of concern about a potential shortage of medical supplies for our healthcare workers. Any movement there? Yeah, and get this number. Today, BC received a shipment of 1 million surgical masks, and the health minister reassures frontline workers that the province's approach is focused on preparation instead of desperation.
In the last few weeks, we've received several orders from various suppliers, including N95 masks, surgical masks, gowns, eye protection, and other PPE that are critical to keeping our healthcare workers safe. The challenge is that global demand is resulting in a situation where our previous suppliers aren't able to provide the bulk, large quantity shipments that will provide us with the comfort we need to say that we no longer have to pursue other supply options. So we're working hard on all of those.
And he made another important announcement today. You mentioned it off the top, but a lot of people were calling for this. So as of April 1st, paid parking at all hospital sites will be suspended for basically everyone, all patients, visitors, and staff. And here's something else we should note for tomorrow. Premier John Horgan is going to be speaking to British Columbians in a province-wide address that will be tomorrow evening at 6:15 on TV. We'll carry it live here and on our website as well, Mike.
Yes, we will. And on the ticketing thing, or at least the pay parking thing, over the weekend we heard quite a few stories of healthcare workers getting slapped with tickets when they were getting off shift. Yeah, here's an important caveat, though. We did hear that the reason being is because a lot of people touch these, pay parking machines, right? So they're trying to peel back the risk of transmission, and also to respect the physical distancing orders, all of those things for safety reasons. But they did note staff who, for example, have kind of a pre-authorized payment that comes out of their paychecks to park, that will continue. So it's not like it's just free for everybody because it's an issue of financial assistance. It's due to the physical distancing measures specifically for those machines on site. Okay, well, thanks for clarifying that. And just quickly, we're going to be speaking with psychiatrist Dr. Shimi Kang coming up in a second. So appropriate to ask you about school. This was, of course, supposed to be back to school day after spring break for thousands of BC students. That obviously didn't happen, but Bonnie Henry talked a bit about that today as well. Yeah, and she did say it's key to really, even though we're not physically with each other, to still stay connected. And so she gave some advice to parents and students, keep allowing them to have those interactions, those social relationships to foster. So if that has to be by text or virtual meetings or on the phone or, via messaging, things like that, to continue doing that. And she also, urged parents to get creative with equipping yourselves with how to learn at home. So, for example, turning your garden or your kitchen into a science lab and doing experiments like that. And she did point to the online material that is becoming available through the province as well. Tanya, thanks so much again. You bet. Tanya Fletcher with us live tonight. And right now, let's get to the live Q&A session where we're going to take your COVID-19 questions to the experts. Today, we're focusing on, as we say, your children, how they're handling the onslaught of COVID-19 information, or how you can help them prepare for a virtual education system, which may well be the direction we're going, and of course, the anxiety and stress that might accompany everything that's going on. You can ask us questions over email. All the information's on your screen there. You can give us a phone call, as some of you are already doing, or contact us online on Facebook, YouTube, or Twitter. We'll try to get to as many questions as we can in the next 10, 15 minutes or so. So as promised, joining us once again is Dr. Shimi Kang. She is a psychiatrist and author of The Dolphin Parent, a guide to raising healthy, happy, and self-motivated kids. Dr. Kang, thanks for joining us again. We appreciate it.
Thank you for having me.
All right, let's get right to the questions. I know we spoke to you last week about anxiety in kids during this time, but a week has gone by. What more do we need to know as the novelty of staying home kind of wears off on this, the day that the kids were supposed to be going back to school?
Yes, it really is a moving target. This is a really important week, as we just heard, from a public health perspective. So I think kids are getting tired, parents are getting tired, but this is a very important week to replay all of the messages from before. Kids need repetition. They need to hear the same thing over again, likely in different ways. And then also give them something to look forward to. So for the public school kids, that school is going to be starting. I know some private schools have already started some activities, getting them to prepare mentally for this idea that they will be back to class and learning as well.
Okay, well, let's talk about preparing for what may well be an online learning situation. Give us some advice there. Does there need to be a set schedule? Perhaps that'll be dictated by the schools, but is a set schedule something that would work better, something that mimics the actual school hours?
Yeah, so everyone's going to have to be creative and flexible in this case. And first, just want to recognize that, you know, the online experience is something that needs to be accessible to every child in the province. So, you know, I think reaching out to anyone who may not have a laptop or phone, if you have an extra one, we really want every child to have the ability to have an education. And I think that is a barrier right now. But having a flexible but firm schedule is really important. So I would encourage parents to sit with your child. It doesn't have to be exactly the same because you're not commuting or driving, but find a time for waking up, brushing your teeth, getting kind of hygiene issues out of the way, breakfast, and then once the school schedules are in, some schools are doing what's called staggered. So every hour it's going to be a different age group. Some are doing all school assemblies. So I think we have to wait and see what each individual school has planned. But you can start talking to your child about that routine. There will be lots of free time or unstructured time for reading, and don't forget recess, meaning that you want your kids to be outside in the sun, in the backyard, or you know, going for their walk. So and then create your evening schedule, so dinner time, bedtime, bath time. So starting to build in a routine is going to be really important this week. Maybe
even homework as well. All right, here's a couple of other questions. How do you socialize kids in a safe way during this time of self-monitoring, physical distancing?
Right. So the easiest way, and if, you know, one of the things that I'm realizing with a family with 3 kids, a husband and my mom-in-law are all here, is we need to sort out a way to socialize together with everyone in the home, but also find that balance of having your own time and alone time. And then really reaching out to your community. So your friends, your grandparents, your uncles, aunts, people that you want to see and connect with. I think that's really important to start making those efforts to do that, scheduling in those phone calls, ideally through video chat or Zoom or Skype or FaceTime or URL Live or any kind of platform. Like, kids do need to see each other's faces. They need to look in each other's eyes, hear voices. So having that is really important. There are a lot of online programs. Our program, Dolphin Kids, is running free interactive live classes all day long for kids of all different ages. And these are run by kids helping kids, doing crafts, coding, math, all kinds of different activities. Those are really great opportunities to communicate, talk, share ideas. So look for those opportunities. They are out there, and many are free.
All right, very good. Next one. How can parents answer questions about COVID-19 in a way that the kids are going to understand it?
Yeah, so this is so important. It's a frequent question I get asked. I always say there's 3 aspects to our communication with children. Number one, we want to tell them the truth. They know what's going on. They can hear conversations and watch the news. So be truthful in an age-appropriate language. Number 2, be optimistic. So in your conversations with your child, find the positive, find the numbers of people who are recovering, find that 42% that you just mentioned earlier that have fully recovered, find the efforts of the healthcare system and how we are ready and working hard below capacity. So find those areas that are really clear, truthful, and optimistic. And then thirdly, give them an action item, give them something to do to feel empowered. So whether it is, washing their hands or wiping down counters, or calling their grandparents, or doing anything where they are feeling active and empowered, where they have a choice and decision-making in their hands, that's going to be very helpful.
Yeah, and you mentioned, of course, first and foremost, telling them the truth, but still some are going to be very scared. How do you try to, as a parent, make it less scary for them?
Right. So a lot of times giving them analogies or metaphors, things that they're familiar with. So many kids have had a flu or a cold. You can use that. You can say, this is similar, but different. So just like with the flu, you can get it from touching people, from people coughing. Just like the flu, most people recover and are just fine. It's not more than a few days, but some people can get really sick just like that. So try to use those analogies. If there's something else in their life that they can connect with, definitely use that. So for younger kids, I recommend play. So drawing pictures, using their stuffies or Play-Doh, all of those ways of enacting what you're trying to communicate can be very helpful. Play is the language of young children. Teenagers, I think you want to start asking them questions, be less instructional and more open-ended and curious about what they know, what they're thinking. Try to get them to talk by asking open, curious questions to them.
Yeah, and at the same time, it can be, it is a very stressful time for a lot of parents. And here's a question about that. How do you try to stop passing along that anxiety to your children?
Yeah, that's such a good question, because there's not just anxiety about health and social distancing, but many parents are worried about their job, how to pay the rent, how to get groceries. So yes, and all of that can easily be transferred onto the child, who is now worried about their home and their security and food and shelter. So really be mindful. It's all of the common sense things we know, but we have to be more intentional and deliberate. So if you're having conversations about finances or loved ones' health or those concerns, really try to do them in a private setting. This is more important now than ever before. I know it's hard. I slip up all the time. If you do slip up, then just check in with your child and say, hey, did you hear what I was talking about on the phone, or, with your dad or whatever? And then ask how they felt about the conversation. And then again, reassure their fears, focus on whatever optimism, positivity you can find. Yes, I'm not making as much money as I used to. Our business is going to be hit. However, there are government subsidies coming. We have this solution. We have this idea. So that's really important, to always give the solution.
All right, here's another one. Any suggestions on how parents can find a moment for themselves away from the kids while having to care for them pretty much all the time?
Right. Yeah, this is such a challenging time for parents in general. Now it's even more. I think, we have to go back to all of those age old, it takes a village to raise a child, even though we are not able to socialize and physically connect like a village. Try to create your virtual village or your internal village if you can. So if you have older children, give them some responsibility to look after each other, to babysit each other, to read stories. If there's a grandparent that's isolated, schedule a story time, a FaceTime, so that you can go take a shower or, have a meal. So really use your community, use your pod, use your village. It's time to be creative. And it's okay to ask for that help. All parents are feeling it. So, have a neighbor or a friend and say, look, can you call my kids at this time because I need to do this and I'll do the same for you. So really kind of tap into your resources.
All right. A lot of us have limits on screen time, the amount of time our kids can spend on the iPad or the Xbox or PlayStation, what have you. Should we be, in some cases, maybe relaxing those rules a little bit as we go through this pandemic?
Yeah, so that's a great question. I have 3 kids. I have 2 teenage boys and a 9-year-old, and screen time is going through the roof for everybody. The best way to think about it is I talk about the technology we consume impacts our mind, very similar to the food we consume impacts our body. No one's going to agree that right now is a great time to be consuming a whole bunch of junk food. We understand that we need to have a healthy diet to stay healthy. And yes, a little bit more comfort food, that bag of chips in this time of stress can be forgiven. So what we want to do with technology is recognize what is the junk tech, that technology that really isn't bringing in a benefit. So I often say things like mindless scrolling. You're not really doing much. Certain video games that are just, the child is like zoning out. There's not a lot happening there. And there's specifically healthy tech. And healthy tech is anything that allows you to create, connect, and care. Meaning if your child is creating things on technology, they're building websites, they're drawing, they're making music, that's good. If they're connecting in meaningful ways, calling people, calling friends, talking to people face to face, that's great. And if they're caring, if they're doing any kind of self-care, so looking at their step, fitness, mindfulness apps, anything like that. So care, create, and connect, that's healthy tech. Limit and monitor the rest, just like you would junk food right now.
Okay, we've got time for one more very quickly. This is right up your alley. What this person asks are the most common ways that kids are affected in times like this?
Well, children are very resilient. Humans are very resilient. I think that we have to really recognize the diversity of how all of us are going to be affected. But there's ways to mitigate any negative impact. The ways to do that is to give them that truth, focus on the optimism, give them action. One of the superfoods for a time like this is contribution. Having your child connect and contribute in meaningful ways. There's a program right now called Kids Helping Kids across the globe. It's children as young as like 9 who are going online and doing lessons and crafts and coding and all kinds of stuff for kids across the world. They're making posters for Italy, and posting them. So having your child get involved is an anecdote. It helps mitigate any kind of negative impact. It makes them feel good about themselves. So I would really try to focus on that to minimize the downsides of this time.
All right, Dr. Kang, we'll leave it there. Thanks so much for joining us again this afternoon. We really appreciate it.
Thank you.
All right, Dr. Shimi Kang, a psychiatrist and clinical assistant professor at the University of British Columbia. Okay, we're going to be back at 6 o'clock once again online and on CBC television for a local newscast. So we hope you can join us then. My co-host Anita Bath has been seconded to the National during this pandemic, and she'll be providing reports into the National right up until 11 o'clock Pacific time tonight. And we are going to get an update from her on the situation with Canadians that are trapped in India. We'll have that online at 6 and on CBC television at 6 as well. For now, thanks for joining us. Stay safe, stay healthy, and if you can, stay at home.